Welcome to Community Conversation. I'm Michael Witsch for LMC Media, and with me on screen is Steve Wolfert. Steve is the president of the Westchester chapter of the Hearing Loss Association of America. Welcome, Steve.
Good afternoon, good morning, everyone. My name is Steve Wolfert. It's good to be with you today.
And you're talking about a Walk for Hearing, which is going to be held at Harbor Island Park on May 19th. Tell us about it. This is one of many walks around the country, isn't it?
Yes. May is National Better Hearing and Speech Month to celebrate, to honor the 48 million Americans, or roughly 1 in 7 people with hearing loss. We conduct 21 walks across the country.
And what's the purpose? Is it just to raise awareness or funding?
Okay. Hearing loss is called a hidden disease, the invisible disease, because it's easy to keep hidden. By trying to keep it hidden, people often lead to social isolation, depression, unemployment, underemployment, and even dementia. The purpose of the walk is to advocate for these 48 million Americans, erase the stigma often associated with hearing loss, and to raise funds for needed services.
Well, I'm somewhat familiar with hearing loss, having been tested myself and having an audiologist recommend that I get hearing aids for certain frequencies. And I also have someone in my family who, when he watches television, has to crank up the volume quite a bit, annoying his wife to no end. Why is there such a reluctance to acknowledge hearing loss?
Okay. Again, there's a social stigma. Services are often not provided for these people. They may be misdiagnosed. They may select hearing aids that are not appropriate to them because they're just not fitted for them by the right professional.
Is it common among just older adults, or are children affected by hearing loss as well?
Well, hearing loss affects people of all ages, young children, infants, teenagers, particularly because of use of amplified hearing devices, adults, and seniors.
So it's common then.
Absolutely. My
That you
son was diagnosed with a profound hearing loss at age 1. Because he was diagnosed early, received the treatment he needs. He speaks and hears perfectly.
And is the Hearing Loss Association of America, it's a national organization, and it's organized by chapter?
Yes. The parent organization is the Hearing Loss Association of America, or HLAA. We have about 150 chapters around the country, as well as a state association in New York and other states. It's located outside Washington, D.C. It supports all the chapters and does advocacy work at the government level as well.
What are some of the technologies that have been developed in the last several years to help people with hearing loss?
Okay, absolutely. Some of the new technologies relate to Bluetooth, streaming of devices directly to a hearing aid or cochlear implant. A device called an interactive loop that could be put around a small room, a concert hall, an airport, which sends sound directly to a hearing aid or cochlear implant. The devices themselves, digital hearing aids, have advanced quite a bit. Cochlear implants have only come into being about the last 30 years for people who would not benefit from normal hearing aids.
Can you explain a little bit about those implants? I think people are familiar with hearing aids, but the implants, not so much.
Absolutely. For people that have the most severe hearing loss that do not benefit from amplification from hearing aids, a cochlear implant is a small surgical device. It's implanted right under the behind the ear, and send sound directly through 22 channels directly to the inner ear or cochlear. It's quite amazing. Again, it's only been in effect about 30 years. It's an outpatient procedure. They are now doing it on people with more moderate hearing loss.
Wow. The May 19th event at Harbor Island Park, I understand that registration starts at 10:30?
Yes, registration and activities. We have entertainment, free food,
Wow.
beverages. We have magicians. We have free hearing tests, thanks to Westchester Medical Center, and a lot of activities starting at 10:30.
And then the walk itself starts at what, noon?
The walk and pre-walk presentations will start at noon, and we do a 5K or 3.2 mile walk around the park, which is
So,
beautiful this time of year with cherry
yeah,
blossoms and right on the Long Island Sound.
yes. And this is for Westchester and Rockland counties.
Yes, it is. And we have people coming from New York City, Long Island, New Jersey, even Virginia, who come to our walk every year. We've been blessed the last 3 years. This is the largest fundraising walk conducted in the spring of about 10 national walks.
So how does the walk translate into funds raised for research and education and support?
Okay. We provide a lot of services on a local and national level. These include testing of all children at birth for hearing loss. That was an effort by HLAA.
Mhm.
Testing of older school children at the grade and junior senior high level. That is now a New York state law. Advocating for Medicare to cover hearing aids. We're not quite there yet, but we're coming very close.
Mm.
Advocating for better services for veterans. Veterans are the hearing loss is the #1 service-related loss among veterans.
Mm.
We made sure that all cell phones are compatible with hearing aids and cochlear implants. We've advocated for hearing loops in concert halls, Broadway theaters, airports, other public venues. And we've advocated for open captioning movies and other entertainment venues. Uh,
So,
yes, locally, we've helped children and teenagers. We've awarded over 40 college scholarships. So kids with hearing loss can attend colleges. And we've given out 3 hearing aid grants last year to needy children who couldn't otherwise afford them.
so the people who walk, have they arranged for donations depending on how far they walk, or that they walked it alone?
We encourage walkers to form teams, to raise funds, to
Mhm.
set goals, but there is no admission to the walk and no donation is required.
So for those who want to walk at Harbor Island Park and maybe are just hearing about this, where do they go for more information, or do they have to pre-register?
Uh, Pre-registration is suggested at the same time once you arrive at the park, and that can be done through our website, which is www.walkforhearing.org. And the 4 is a numeral 4, walk numeral 4 hearing.org.
The website that HLAA has, it's got a lot of information, and I saw some advice that I decided to take to heart. Um, One is get tested. It's never too late to find out, and it's not something that is onerous. I mean, it's not something that your family doctor does. So you need to see an audiologist. Correct.
Absolutely, a medical doctor who is trained in ENT work, specializing in the ear, can do a quick and thorough test to determine if you need follow-up.
And as you said, on May 19th, people can get a free test.
Yes, Westchester Medical Center has a large medical coach. They are bringing to the walk. Their professionals will staff it, and anyone who wishes can get a free hearing test. This is the first time we're doing this, so we're very excited.
Wow. And another piece of advice on your website is for people who have hearing difficulties, they should acknowledge it and speak up. Ask people to perhaps speak a little louder or to face you when they're talking. Um, and then investigate the technology that's available. I know that when I was offered hearing aids, I expected a large piece of plastic, something to sit on the back of my ear. And I was very surprised that it's very tiny these days. And a clear tube, almost invisible, goes right in the ear.
Yes, devices become miniaturized, much more powerful. They often have rechargeable batteries.
Mhm.
Again, they have what's called a T-coil switch, which enables you to hear sound directly at a concert, a movie, other venue, without any background noise or interference.
And the other piece of advice was protect your hearing, uh, both your hearing as an adult and your children's hearing. How do you do that? Just don't listen to loud music, for instance?
Absolutely. I mean, you only have one set of ears, as you only have one set of eyes. Uh, Protecting yourself against loud noises, whether they be at an airport, a construction site, certainly a music venue, listening to music on your iPhone, turn the volume down, preferably wear exterior headphones. These are all things you can simply do. If you feel an ear infection or anything that's quite common, go to a doctor, go to the ENT specialist.
So let's finish up by reinforcing what's going to happen on May 19th, a walk for hearing. Where is it again?
Harbor Island Park, 123 Mamaroneck Avenue in the town of Mamaroneck.
And it's on May 19th, and registration starts at 10:15, 10:30, and the walk
Yes,
itself around noon.
correct. It's rain or fall. We'll have hundreds of walkers, friends, family, co-workers, as well as people from the hearing community. All the major Westchester hospitals will be there, audiologists, hearing aid manufacturers, cochlear implant manufacturers doing demos and answering questions.
Oh, so you could learn a lot too, not just.
Absolutely. Education's a big part of it. Yes.
Steve Wolfert, president of the Westchester Chapter Hearing Loss Association of America. Thank you so much for spending a few minutes with us on Community Conversation.
So nice to be with you, Mike. Thank you.